Bismillahirrahmanirrahim. Welcome to Medical Club e-learning. This is Hafsa Muki from FMDC and we are doing general anatomy. This is chapter 3. First of all, table of specification. It indicates there will be 1 SCQ and 7 MCQs from this whole little book. First of all, bones and cartilages. These are two different sections of this chapter. Skeleton, this first paragraph is not important for your reading. You can read this. Bones are important, and first is the functions of bones. This is important for your SQ. There are mechanical functions, physiological functions. These are all important. Then is the types of bone tissues. This is again important for your SQs. So you have to do all the highlighted text. Region distribution is important for your SQ. This whole table is often asked in MCQs also. So this is important for your covering this. Next is the classification of bones. First of all, you must know that in general anatomy, classifications are almost always important. So there are different types of classifications of bones. First is the developmental classification. Important. Regional classification, again important. The classification or the size and shape, this is again important. So it can be asked about individual type of classification. So you have to do all the classifications. It is better for you to make a flow sheet of all classifications and then classify all the bones. Like you must know the examples in each class. That's the trick about the classifications. You just need to know the classification headings and the examples. This is continuation. You must know the classifications. Important MCQ points are written along with the lines so you can easily find them. Next is the topic of, these are all MCQ points. Next is the topic of markings and impressions on a bone. This topic is not important. You are not asked about these markings of the bone in general anatomy. These are all headings and these are not important for your general anatomy. You will be covering these topics in cross anatomy. So from here, if you have enough time or it is for your interest, you can read this topic. Otherwise, it is not required. These diagrams are helpful in understanding the bones and different structures of the impressions of the bones. Next is the topic of this is continuation of that same topic. Next is the typical long bone. This is important topic. First of all is the gross anatomy. The gross anatomy is not as such asked, but you should know the gross anatomy of a typical long bone. The ends of the long bone is important for your understanding. The question for your paper is the types of epiphyses. There are 4 different types and these are important for your written paper in your essay. The development of bones, like how the ossification occurs, this is important for your SCQs. The different types of ossifications, intermembranous and intercartilages, these are important. Next is the bone growth and remodeling. This is also important for your SCQ. It is the question like what is the epithelial cartilage or the growth plate. So this is important and it is highlighted. It is for your understanding. It is for your paper. Now is the rule of ossification. The rule of ossification is again important. And the question is, what is the rule of ossification and what are the bones which violates this rule? So this is the answer. Fibula violates the rule of ossification. And these examples are also important for your MCQs. Next is the blood supply. Blood supply is extremely important topic of this chapter. This is almost often asked question, so you must know this arterial supply and the venous supply. The diagram is compulsory. You have to draw this in your question. So practice this well. Next is, these are different arteries, the branches of the arteries and the venous drainage. This is all in your question. Next is the blood supply of short bones and flat bones and irregular bones. These are not as trust in your SCQ, but you must know for your MCQs. So I've highlighted all one important. Now the bone injury and repair, this is just for your reading, as such not important. Healing of the fracture, it is just for your understanding, not as such important. Next section of this chapter is cartilages. This is very important topic. Cartilages are very hygiene for your SQs. You are asked about what are types of cartilages and what is the distribution. So distribution are the examples of different cartilages in the body, and these are very important for your MCQ points. This is continuation, the fibrocartilage, another type, and the MCQs, the elastic cartilage and its distribution. So this is very hygiene topic for your paper. That's all about chapter 3. Stay tuned for more review.
मेडिकल ग्लोब पब्लिकेशंस लेकर आया है आपकी खिदमत में प्रोफेशनल एग्ज़ाम से रिलेटेड आपके तमाम मसाइल का हल। जी हाँ, MBBS क्रैक्स, इसमें मौजूद है चैप्टर वाइज इंपॉर्टेंट टॉपिक्स की मार्किंग, साथ ही साथ इसमें यूनिवर्सिटी के पास क्वेश्चन सॉल्व करके दिए गए हैं। इसके अलावा इसमें इंपॉर्टेंट वाइवा क्वेश्चंस मेंशन किए गए हैं, साथ ही साथ हर चैप्टर के इंपॉर्टेंट पर्ल्स मौजूद हैं। इसके अलावा हिस्टोलॉजी की डायग्राम्स आपको यहाँ पर मिलेंगी और ऑस्पी की मॉडल पिक्चर्स भी इसमें ऐड की गई हैं। इसके अलावा मेडिकल ग्लोब मुतारफ़ करवाता है अपनी कामयाब MCQs क्रैक्स की सीरीज़। इसमें मौजूद है MCQs से रिलेटेड आपके तमाम मसलों का हल। UHS के अलावा दीगर यूनिवर्सिटीज़ की MCQs इसमें ऐड किए गए हैं। तो अभी घर बैठे इस मौके से फ़ायदा उठाएं और इस बुक को ऑर्डर करें हमारे दिए गए नंबर पर। नंबर है 0335 6633 007। शुक्रिया।